Good afternoon, everybody. So everybody want to stand up and take an after lunch stretch? There you go. There you go. Take it up. Shake it out. And rub your heart and make sure you know that recovery is real and 23 million people strong in the United States. 23 million of us. Yes. It's happening all around us. And I was so proud to be among the people in this room that stood up for recovery this afternoon. Oh, thank you. That helps when you can actually move your slides, right? So I am a woman in long-term recovery, and for me, that means I've been alcohol and drug-free for, it'll be 22 years on the 20th, God willing. And I come here today to North Dakota, and it's cold for us Southern girls. I come here today with two hats on. As Catherine said, I am a recovery advocate in Washington, D.C., and I also help my husband stand up the McShin Foundation, which is a recovery community organization in Richmond, Virginia. And I want to tell you a little bit about how I got to be a recovery advocate in Washington, D.C. I'd love to tell you I had this great career plan that I sat back and thought up. But like a lot of things in recovery, you know, synchronicity and grace got us in our path oftentimes, and it is through no design of my own. So I ended up, I was working in a really big accounting firm at the time called Price Waterhouse as a legislative analyst. And ironically enough, I was working in their health and employee benefits practice, where people were really knowledgeable about employee benefit plans, including, you know, your health care insurance and what it doesn't cover. And my alcohol and drug problems were getting worse, as they tend to do. And my employer, my family, decided to do an intervention on me. And this was back in 1989 when dinosaurs roamed the earth. I'm dating myself here. And, you know, as they did those old-timey type of interventions, if anyone else is old like me, where your bags are packed. And they hired an interventionist who, you know, decided that the only place you could reliably find me after work was at a bar. And the bags were packed in the back of the bar. And I walked in and I saw my mother from North Carolina and my boss in the back of this bar, neither of which who frequented this place. And I thought, this can't be good. And so I did what any normal person with an alcohol and drug problem would do. I hightailed it the heck out of there. And the interventionist, he was a kind of a slight little man. I'll never forget him. He wasn't ready for me. And I, you know, hightailed it down the sidewalk in D.C., and he chased after me and brought me back in. And we're all here to tell you we love you. Anyone who's been through this knows how this goes. And there was a bag packed, and he said you can go to Hazleton in Minnesota or Florida. And then we're, you know, out like any good person in November. I went to the Florida one, right? So, you know, years I go through that program, I get into recovery, and about, you know, I'm in recovery for a while. I'm back in Washington. I'm working in government relations, and I go to a firm, and they say, if you come here and work for us, here are the clients you'd have to service, and who's on the list but Hazleton? And of course, being, you know, oftentimes in recovery, we have a chip on our shoulder. We think the world's is out to get us if we haven't done all of our work yet, and I clearly hadn't. I wasn't quite done yet. I think I had like 2.5 years, something like that by then. And I thought, oh, they know. And this was before the face, you know, put a face on recovery movement was fully going on in the country. He knows where I've been, and this is his slick way of telling me. And he goes, do you know what they're all about? We just signed them up as a client, and I don't really know what they want. And this was in 1993 when, for those of you who don't know, there was this major effort to try to overhaul the healthcare system by Hillary and Bill Clinton, who was president at the time. And so healthcare advocates were in big demand. And I said, yeah, I know what it's all about, with my little attitude, my little chip on my shoulder. I said, yeah, I know what it's all about. They probably want to have addiction in the healthcare benefit as a real benefit and not as some add-on thing on the side. And I thought, well, I'll never get this job. He's probably heard all the stories about me standing on the tabletops up at the Bullfeathers bar and all the other thing Irish Catholic drunks do, right? So, long story short, I get the job. I start having to service the Hazelden account. And my boss says, you know, we got to go up to Hazelden and figure out what in the world they want. And I thought to myself, oh my gosh, you know, my counselor is going to come and greet us, and my boss is going to find out that I'm, in fact, I was a patient there, blah, blah, blah. So in the meantime, we've sent out these announcements that I'm going to become a vice president at this firm. I mean, the job was way above my head. I had no ability to bring in business. Like, I had the whole thing kind of accelerated on me before I was ready. So anyways, I was nervous across the board. So I go into his office and I'm like, if there was a cartoon picture of what a lobbyist looked like, it was this guy, my boss. You know, at the time he like smoked cigars. It was in this high palatial office with the big ceilings and everything. And my knees are knocking. And I go in and I'm like, Duffy, I need to tell you something. And he looks up from his desk. He's signing all these papers. He goes, what, McDaid? He always called me by my last name. And I said, I went to Hazelden. And he goes, would you go up there for a conference or something? No, I was a patient there. And he puts down this beautiful Mont Blanc fountain pen he's writing with. You were a patient there? He goes, you don't look like an alcoholic. And I said, you look like the girl next door. Why no? You were a patient at Hazelden? Yeah. He goes, you were an alcoholic? And I was like, yeah, and a drug addict, yeah. And he gets up, puts the pen down, he's pacing back and forth. And I'm thinking, oh my God, my poor mother, I sent all these announcements out that I'd become a vice president. She's gonna die of embarrassment. She's told all the friends in the bridge club that I've got this hotshot job. He's pacing, not saying a word. Then all of a sudden he goes, McDaid, they're gonna think I'm a genius. Here's what we're gonna do. We're gonna tell them I hired them just to service your account. Then we're gonna go get Betty Ford, because at that time they were two separate places. Then we're gonna go get this one, that, and the other one treatment center. And you're gonna become the addiction. This was before recovery was even a concept, you know. You're gonna become the addiction lobbyist in Washington. So that is how my career started, by someone else's business, you know, model, not by any design of my own. So that is how I became a lobbyist in Washington, through synchronicity and grace. It's called being at the right place at the right time. But I was completely passionate about the cause, because someone else's dream for you can only get you so far, right? Many of us have tried to live other people's dream for us, and it doesn't go but so far. Why I was passionate about the cause that Hazelden wanted that firm to work on for them was because I was working for a large firm that had Cadillac, I mean the top of the line insurance plan. And when it was time for someone like me to actually access that coverage, it was not available. It was only there on paper. It said it covered residential addiction treatment, but right in the time of crisis, it said it wasn't medically necessary. Now, I had already been to outpatient twice. I had done this and that and other step therapy protocols you needed to do. but they were looking for any way that they were not going to be able to pay in this instance. And so I thought, gosh, and I was lucky. I had a family that could pay out of pocket for me to go. But so many people didn't have that luxury, and I knew that, and I thought, by God, that's just not fair. And so I had my own burning passion about why I wanted to continue that work, why I wanted to do it, not only for Hazelden, but for so many Americans who were kind of dealt a bill of goods, right? You read it in your insurance booklet that your employer gave you that it was covered, but when in fact, when you or a loved one needed to access it, it really wasn't what it said it was in your booklet. And so began the journey of my interest in wanting to help people who, on insurance issues. And that's why I later went on to make it my life's work, frankly, because it took us 20 years to get parity passed, which is a law that requires insurance companies to cover addiction and mental health like they do other physical conditions. Why I worked on that for so many years, which I will get to in a minute. So I wouldn't be much of a recovery advocate if I didn't try to activate you to become one in the way that you can too. And that doesn't mean that you need to do what I do, which is to have it as my full-time job. It doesn't even mean that you need to have any type of credential, any degrees. It doesn't mean that you need to work for any particular organization. I'm a big believer in growing where you are planted, and all of those that stood up, or all of those of you who are here, who are a family member, or even a professional ally of somebody who is seeking recovery, or you treat or serve people who are in or seeking recovery. I'm a big believer that gratitude is not a noun, it's a verb. And what I mean by that is we show our gratitude by the way we act. We don't just say we are grateful, we show we are grateful. And one of the ways that we must show it is by acting and behaving as if we are grateful. And I have been, through my work, to a bunch of different states. And I get to do talks like this, but I always make sure I stay over a day like people in the community so that I can get to be with you, and not just with you, talking to you or talking at you, but actually being with you and asking questions about how things work in that state. And I am stunned. What is going on in North Dakota? I mean, one of the reasons why I came and why I'm here today is 3 years ago, I sat at a Washington hotel restaurant with the First Lady here, Catherine Burgum, and she sat down and asked me what she thought that she should be most interested in working on in the addiction recovery space. And you know me, how shy I am. I sat there and, just laid out a bunch of different options. And I mean, 8 out of 10 things we talked about, she has implemented. She and the governor. She and the governor and her agency partners and all of their colleagues and all of you. Let me give credit across the board here. Who does that? I mean, not in our field. There's a lot of people who are big talkers, and for a bunch of different reasons, barriers, time, money, there's a whole lot of good reasons, but people don't always do what they say they're gonna do, and she did. And if she came here and said, go out in the deepest, darkest winter in North Dakota, stand on the corner and spit wooden nickels, I'd have come here and done it. I mean that. I mean it. She's a doer, and I really love doers. So I'm gonna, for those of you who aren't familiar, what does she mean by advocacy? What does she mean by acting? If you all have a 2-year legislature, meaning your state the folks that make your state laws, they're only here every 2 years. They're regular people. They put their pants on one leg at a time, like the rest of us. If you don't educate them about addiction and recovery, and remember, they have full-time jobs, they teach, they run small businesses, they have plenty of stuff to do, they have families, small kids to raise, all the rest of the stuff that all of us do. You think, and they've got all these other bills to look at, all these other issues. If you don't teach them about addiction and recovery, who do you think is? It's not Catherine's job to do all the teaching and the advocating and the educating. It's not Adam's job with F5 to do all of it. He does a part of it. It's not the governor's staff that does all that, or Pam from the Behavioral Health Authority. If you don't show up at hearings and educate state legislatures about what are the critical elements that make recovery possible, how are they supposed to know that? Osmosis? You think they're going to read medical journals on Saturday night? No. You have to act. Now, is that right for everybody? If you have a safety-sensitive job, are you supposed to be the guy being interviewed? If you work for the FBI, that's probably not how you play a role in this. But can you Xerox flyers so that right before, if there's a bill and somebody needs to pass stuff out, that can be your way you act. But everybody can act in some way. Don't sit back and think, well, I can't do anything. That's for those people that set up tables next door. No, it's not. Everybody can play a role. If you think, well, Carol, I'd love to help, but I don't know what to do. I don't understand. Right here on the slide, it says you ask for change, you tell stories, you share ideas, you provide information. Who in here that's in recovery doesn't have information on what helped them get recovery? Nobody. Your personal story is power, people. It is power. That is information. People need to know it. If you sit on it in a church basement and keep it secret, who do you think you're helping? Yourself. That's it. And that's good, but it's not enough. It's not enough. You've got one of the most amazing state governments in terms of they have invested in recovery, and not just with money. I mean, I've never seen state government officials that have such passion. I mean, they're like me, that you'd think this is all they do all day long. Like, I mean, my husband and I, when I talk about what we've done at McShin, he's done all the work with the team. John, raise your hand. Raise your hand right there. Afterwards, if you have questions about McShin, since I'm using the royal we, because him and his team do all the work, you can see John. But this is our life. This is our life's work. This is what we're passionate about. And I mean, yesterday I met with y'all's state behavioral health authority, and she's got the same passion we do. I mean, she gets recovery down at her DNA level, and she's not in recovery. I mean, y'all are so lucky. They've made investments of their time, their passion, their money. The governor's the same way. It's not just Catherine. They get it, and they've put the money in here. My husband spent the day at the prison here yesterday. He said he's never seen anything like it. And yesterday, North Dakota was the 38th prison he's visited across 30. He's trying to get to all 50 states. North Dakota made the 38th state he's visited, and he said he'd never seen anything like it. So please don't take for granted what you have here. But I'm here to tell you, you will lose what you have if you personally don't take responsibility for continuing the work. Don't take it for granted. They cannot continue to do all this work for you. You in recovery, you family members, you professional allies have to pick up the mantle They have set the table beautifully, I might add, but you have got to play your role. I hear that there's not many advocates at the state capitol. I hear there's not that many coalitions that they can tap when they're needed. And I'm going to tell you some lessons learned that John and I have learned in doing this work that maybe you can borrow some and learn from our mistakes. So if you wanted to put together a coalition, you got to figure out a way to figure out what your community needs if you don't already know. One of the things I always like to do, John likes to just hit it and run. I like to survey the recovery community and other stakeholders. If you don't know for sure what everyone wants, I don't like to guess, I like to ask people. And I like to figure out what resources you already have, and then put together a coalition of stakeholders who want to work together on whatever it is that you decide you need. And I know this graphic is pretty, convoluted, but basically the buckets, if you will, of areas you might want to look at to see what resources you already have are prevention, this is not rocket science, but prevention, treatment, harm reduction, judicial and law enforcement, housing, education, employment, and recovery support services. Now, y'all have got a massive head start on recovery support services here. I'm just so impressed. I don't know so much about prevention. Treatment seems a little thin, but I could be wrong. And I don't know about all these buckets, but if you wanted to decide to act, most communities that we've worked with kind of inventory what they got in those areas and then figure out, hey, we want other things other than this because that's what our community needs. You take a look at those, you add that, and then you get busy. And remember, in recovery, when you're going to treatment, oftentimes people give you a list of the symptoms you have. Recovery advocates take a look at the resources we have first. We don't talk about pathology. We come from a strengths-based approach of what we already have. So we don't sit around and whine about what we don't have first. And people do, you kind of turn them around to what recovery advocates do. We look at what strengths we have in the community first. We decide what we're missing. And then we figure out, well, who in town might be able to help us get what we are missing? And we think creatively, and we bring them in and ask them if they can help. And you create a list of the resources you think you have in each of those buckets, and then you identify your partners, and then you get busy. This is a way that you can kind of get going and get busy. Now, I wanted to, as I mentioned, see some areas where you could learn from my mistakes. One was this work that we did on the parity law. It was simply, the law passed in 2008. We had worked on it for 12 years before it passed. And again, very simply, just requires insurance companies to cover addiction and mental health like other physical conditions. Now, it took 12 years to pass. It might not have taken that long if people like me were not such purists. For a while, the addiction community was here, the mental health community was there. Never the twine shall have met. It was a massive argument all the time between all the advocates. We would never work together. A lot of people were arguing at that time in the mental health community that addiction wasn't a disease and we were going to bring their efforts down. Well, we took great offense to that, as you can imagine. And it drew the issue farther apart because the federal legislators were like, well, you guys can't get your act together, you don't agree, you're saying this, the other one's saying that, and so they did nothing. So it kept taking more and more time. When we started working together, which frankly didn't happen until Patrick Kennedy took me behind closed doors and said, you're gonna have a joint coalition or I'm not gonna help you carry this legislation. He did not say it very nicely, and he made us do it, and at first it was hard. No one spoke to each other. It was not an easy coalition to run, but finally it worked, and nothing helps a coalition get unity like success. And when we started having some success, everybody wanted in, and the bill passed, but only when we started working together. So please learn that unity, which is a principle that a lot of us are familiar with, is essential in coalitions. Now, for those of you interested in thinking maybe the next step for North Dakota, or Bismarck, or Fargo, or wherever you live in this state, maybe we want a recovery community organization. And what I mean by that, it can mean different things in different places. And again, you tailor it to what you need. Please be aware that this is what we needed in the Richmond, Virginia community, and you tailor it around what you need. And I'm just going to tell you the story of how we started it. Again, my husband and I, we are not twins. We think differently, we operate differently, we share a passion for recovery. John and I, we were at a 12-step camp out. He kept bringing, people who needed recovery to our home. We were running out of sofas. His daughter was getting older, and, bringing all these guys home from jail, her mom wasn't, too keen about all of it. And we talked about starting an organization. It seemed like maybe, one of those things you talk about around a campfire. And that was Saturday night. That Monday, he called me, "Hey, honey, I got the 501c3 filed." And I was like, 501c3 filed for what? And he's like, for the recovery community organization. And I was like, what? We don't have a business plan. We don't have our board selected. And he's like, so we're good. We're ready to roll. And, I've been accused of being overly cautious before, and he's been accused of being a gunslinger and shooting from the hip before. And he's not going to listen to me anyway, so he found somebody to donate, 300 square feet of space, and he had a sponsee that lent him a phone, and he bought a coffee pot, and off he went, right? So that was how McShin started. And we were both committed to it because we lived in a state that had a 23-day waiting list for public sector access to treatment. And it was really starting to grate on me that I'm like doing all this work, and by then the recovery put a face and voice on recovery, and I'm representing all these fancy treatment centers according to Duffy's dream by then, and I'm doing nothing in my own backyard. I mean, it was starting to be guilt-inducing, and so it made sense to me. I didn't quite know we were going to just kind of do it out of the back pocket like that, but, I'm married to John. I knew it was going to be a ride, so off we went, So we got going. The things we offer are right here on this slide. We've got peer recovery support services, and that means they're non-professional, non-clinical. We do housing. We do jail-based recovery support services, John's passion. Don't need to tell anyone here. In our state, you lose your license for a year if you have a drug or alcohol conviction, so transportation was big. Employment is big. I think most of you know who pays for recovery support services, but it can be Medicaid. Individuals and families can self-pay. It can be federal or state grants. Counties can pay for it. States can pay for it. Private insurers, managed care companies. These are the main things we do. Recovery. We have a big 15,000 square foot recovery community center, which was originally donated by a church. We've got 120 recovery housing beds. We help people get jobs, and we do these jail-based recovery support services, and we do a ton of advocacy. We do not have a state like yours. There's been tussles between the recovery community, the state, and treatment. The state feels like they need to keep the money that they get and not spread it around to the recovery community. And I think there's been an attitude that the recovery community are still thugs and gangsters. And it's slowly changing, but not enough to give us money type of thing, ethical, all that kind of stuff. So we're still working on that. We never give up. That's the other thing. Just never, 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 never give up. So, in order to fight that stigma, though, we learned we had to do these things. We had to, be a good listener. We need to make the community feel heard. We have to model servant leadership. We find that if you do community service day in the neighborhoods where we have houses, we're better liked. We provided free services in the jails for a long time. And we have alumni groups, and we empower them to do things so that they feel connected. We have great relationships with the media, and we do human interest stories all the time. I provided a ton of resources if you are thinking about doing something in your community and you want to know where there's eligible funding. In the Recovery Resource Expo and on the website, you can see some of the funding sources that I laid out for those of you who are interested. And there's also going to be some funding that's made available through the opioid litigation lawsuits. Now, before you say, well, opioids aren't our thing, it's meth and it's alcohol, some of that funding is going to be, as we call it, flexible. And you will be able to use it for non-opioid uses. You just have to have a great relationship with your AG, who has to kind of negotiate that flexibility for you. And I've been so honored. I know that was a bunch of content all at once thrown at you, but I am happy. I'll be here the rest of the day, and I'm delighted to answer questions. And again, if you want to know stuff about what McShin does, how and why we do it, John will also graciously agree to hang around, and he will answer questions about McShin. And thank you for your attention, and it's just been a delight to be here in North Dakota. Thank you.